Good morning, everyone. Breaking news just into the newsroom about an hour ago. 8 of Nebraska's major healthcare systems issued a joint statement saying vaccinations for employees will be required. This, of course, brings up a lot of questions. We want to bring you the answers we can. The chief medical officers from all 8 of the healthcare systems to sign joint
for the benefit of the news media, I'm going to put up on the screen
Let's
here the names of the chief medical officers. You'll see their names displayed as well as they're speaking. But I thought for the benefit of everybody who's watching and taking notes, these are the names of our CMOs who are participating. I also wanted to take a moment to just read a statement that was shared publicly about an hour ago and kind of restate the reason why we're here, and then we'll turn it over for questions. So the statement reads, to ensure the safety of our patients, employees, and communities, several of Nebraska's leading health systems will require all employees to be vaccinated against COVID-19. The COVID-19 vaccine is safe and effective at protecting against serious infection and hospitalization. More than 125 professional health associations and healthcare systems are calling for mandatory vaccination of healthcare professionals. Unvaccinated employees and physicians may apply to their employer for medical or religious exemption. Each of our organizations take very seriously the responsibility of providing healthcare to people of all ages and backgrounds in our communities. Vaccination against COVID-19 is an important step to stop the pandemic and allow our teams to work in the safest way possible. We strongly encourage vaccination for all eligible individuals in our community. So with that, members of the media, we'd like to open it up for questions, and members of our CMO panel will answer in turn. So please feel free to begin asking questions. If you prefer to use the chat, go ahead, but I'll leave it up to you to go in order and do as best as you can to not speak over each other. So please go ahead, colleagues.
Hi, Waverly here from KTV. Can everyone hear me okay?
Yes.
Okay, great. So I just wanted to go over if everyone, or maybe if there's a list of like how many employees are we talking about that are already vaccinated versus how many that are not? And like, are these like just medical staff? Are they custodians, people who work in like the dining halls? Can you just kind of go over that information?
Sure, and I'd be happy to kick that off. Before answering that question, I'd like to make one introductory comment, if I could. You know, I've been a proud Nebraskan my entire life, and I think, to quote one of my colleagues, Dr. Chris Maloney, the pandemic has really served to bring forth a silver lining, or the silver lining in the pandemic is that we've all come together as chief medical officers and leaders of our health systems for the betterment of the community. And I think today, this joint statement really highlights the pride that I feel and that I believe my colleagues feel as well. This is very unique. I've not heard of other communities having done this. And I think it speaks to the commitment that we all have as competitor health systems who want to do the best for our community and do it together. And I think that should resonate loudly with not only all of you on this call today, but also the members of our communities and the populations that we serve. So thanks for letting me make that comment. To answer your question, in Nebraska Medicine, we have roughly 80 to 85% of our workforce vaccinated. There's the remainder, 15 to 17%, that we either know are unvaccinated or have not disclosed their vaccination status. And that's inclusive of all workers, whether they be nurses, other ancillary care providers, environmental staff workers, et cetera.
I can answer for Bryan Health. Bryan Health, our employee population's at 85% vaccination rate. And really, when you ask who's not vaccinated, I would say it crosses the spectrum and for a variety of different reasons. So we still have different types of staff, whether it's nursing, environmental services, registration, a number of different staff that may not be vaccinated, again, for a variety of reasons. We actually took a poll to ask those reasons. Some of these were just concerns with vaccine safety, personal preferences, concerns for untoward effects or reactions. So a variety of different reasons why.
Speaking for Methodist Hospital, I would say we are approaching the 80% vaccination range. I think of great importance is the fact that over 90% of our doctors are vaccinated, which speaks to the overall feeling of the physicians in this institution that vaccination is the way to go.
Yeah, and I would echo from Children's. This is Chris Maloney. We also are approaching the 80% mark, and it crosses all spectrums inside of our organization. And as Dr. Blatchford discussed, our physicians, both our primary care physicians and our specialty care, are well over 97%. And likely that number will increase as well going forward. It should also be noted that the vaccine is very safe. The reason it hasn't gone through FDA approval is more around supply chain and storage and how do you get it to people rather than the safety and efficacy of the vaccine.
Terry Ward with CHI Health. Along the same lines as everybody else. I think we all have about the same vaccination rates for our physicians and our nurses. I do want to quickly echo Dr. Frankel's comments. I remember our first outbreak in Nebraska was in Grand Island, and we had just overwhelming numbers of patients. And so many people on this call and on these screens took those patients for us and helped share the burden of all this. And that was just the beginning of this collaboration together, where we have been meeting together almost weekly to talk about testing, vaccination, policies about visitors, policies about elective surgery. We have done so many things together. And this is just one more great example of everybody working together. We have about 11,000 employees across our hospitals. And so we still have, it's going to impact a lot of people, but that's currently similar rates. We will require vaccination for everyone who comes in contact with our patients in our hospitals. So doctors, all staff, even vendors that come in the hospital.
Could one or more of you, I'm sorry, go ahead, sir.
This is Don Schmidt from Madonna. We have about 2,100 employees. Currently, we're sitting right at 80%. But on a positive note, we've really seen an increase, a measurable increase over the last month in the voluntary vaccination. This will include everyone. We did announce this to our staff late yesterday afternoon. And on a very positive note, the feedback we've received thus far is very positive. There's overall essentially a collective sense of relief that is coming in that feedback.
A couple quick questions. One is, I'm wondering what the legal standing is. I'm sure your counsel, your attorneys have looked into it, what the legal standing is on mandatory vaccinations in Nebraska. And number two, what are the implications for an employee who still declines to get vaccinated?
So this is Chris from Children's. Of course, we always bring our legal counsel in, and sometimes we consult external counsel as well. This has been attempted in many other organizations across the country. There have been legal suits brought against organizations, and none of them have brought merit. And so we feel, and this is why we're going as a group, we felt it's very, very important that as the healthcare systems in Nebraska, that we do this as a group, because we want to make sure that not just one person is getting out ahead or behind. As you've heard, we have been doing things in combination with all of the systems since the middle of March of 2020. And this is just another example. This one may be a little bit more prominent because for some reason a vaccination and a mask have become political. They're not. It's all about healthcare. And remember, at Children's Hospital and Medical Center, the majority of our inpatients are not even eligible for a vaccine because they're less than 12 years of age.
I wanted to share a question that came in through the chat, and this is about hospital capacity with growing numbers of COVID across the state. Is there concern amongst the chief medical officers and the systems in which they serve about impacts on capacity?
Sure, Paul, I'd be happy to address that. This is Harris